Today's medical-centric topic is, how long does Viagra last? Viagra, or Sildenafil, is a medication commonly used to treat erectile dysfunction, ED. One of the most frequently asked questions about it is, how long does it last? The duration can vary depending on individual factors, but understanding its effects and timing can help optimize its use. 1. How does Viagra work? Mechanism. Viagra increases blood flow to the penis by relaxing the blood vessels, making it easier to achieve and maintain an erection when sexually stimulated. Onset time. It typically begins to work within 30 to 60 minutes after ingestion. 2. How long does Viagra last? Duration. The effects of Viagra usually last between 4 to 6 hours. Peak effect. The strongest effects are typically felt 1 to 2 hours after taking the medication. Individual variations. Some men may notice lingering effects up to 8 hours, but these diminish over time. 3. Factors that influence Viagra's duration. Dosage. Higher doses, that is 100 milligrams, may last longer than lower doses, that is 25 milligrams, but also carry an increased risk of side effects. Metabolism. Individuals with faster metabolisms may process the drug more quickly, shortening its effects. Age. Older individuals may experience longer-lasting effects due to slower drug metabolism. Food intake. Taking Viagra on a full stomach, particularly after a heavy or high-fat meal, can delay its onset and reduce its effectiveness. Alcohol consumption. Drinking alcohol can decrease Viagra's effectiveness and shorten its duration. Health conditions. Conditions like diabetes, heart disease, or kidney issues can influence how long Viagra remains active. 4. Tips for optimal use. Take on an empty stomach. For faster results, take Viagra without food or with a light meal. Plan ahead. Allow at least 30 minutes for the medication to start working. Avoid excessive alcohol. Limit alcohol to ensure maximum effectiveness and reduce side effects. Communicate with your partner. Timing sexual activity can help you make the most of the drug's window of effectiveness. 5. When to see a doctor. Lack of effectiveness. If Viagra doesn't work as expected, consult a doctor to adjust the dosage or explore alternative treatments. Side effects. Seek medical help if you experience prolonged side effects like headache, dizziness, or vision changes. Priapism. An erection lasting more than 4 hours requires immediate medical attention to prevent long-term damage.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.